Good afternoon, everyone. Respected chair, co-chair, dear panel members, and my dear brother and sister. Thank you so much for having me here and allowing me to share our experience of community-led monitoring project, which we are implementing in Manipur, India. This presentation will show how community-led monitoring has a bigger impact than just checking health services. It started by looking at access to HIV and hepatitis B care, but it also found serious problems like unfair treatment and human rights violations. So this presentation will explain how CLM help improve health care and also bring attention to the challenges faced by the marginalized peoples. So let me just begin my presentation with a brief introductions about our organization. CON stands for Community Network for Empowerment, which is a drug users-led network of 7 community-based organizations of people who use and inject drugs based in Manipur, India, and it was established in 2011. Since its inception, we have been working with a range of activity, which include improving access to screening, vaccination, diagnosis, and treatment for HIV, viral hepatitis B, and hepatitis C. Key activity include community-led monitoring of health services, particularly those related to HIV and hepatitis, to ensure quality and accountability. Our organization also work on addressing human rights violations against vulnerable groups, especially people who use drugs. In addition, our organization also actively work to reduce stigma and discrimination with a special attention to the need of women and children. So coming to the main topic of my presentations today, in 2021, we launched a community-led monitoring initiative in collaboration with 2 community partners, CON in India and Peduli Hate in Indonesia. Together, peers from this organization have jointly developed the framework to monitor key HIV and hepatitis C indicators across 6 health settings in each country, including referral and the district hospital. During the initial phase, the International Treatment Preparedness Coalition provided technical support and managing data system which rely on paper-based documentations. On the top right, you will see the report that capture the impact of, capture key lessons learned and impact of CLM initiative on HIV and hepatitis C in India and Indonesia. By 2023, we introduced a digital platform to make data collection and visualization more easier with the support from the MFAR Andelson Office of Public Policy. This project is the first community-led monitoring effort in Asia-Pacific region that track hepatitis C indicator and show the data through the public dashboard. This help promote transparency and accountability in health services. So below is the snapshot of the ComCare app that our data enumerator use for real-time data collection. This tool help us to track things accurately and consistently. It connects directly to our online system so we can quickly analyze the data and share update with the public. Since the digitalization of the community-led monitoring initiative in February 2023, we have reached a total of 1,758 care recipients. This is a number for India only. I'm excluding Indonesia as I'm presenting my country as of now. So of this, 62.4% were male, 37.3% were female, and 0.3% were transgender. In terms of the health condition, 62.3% were people living with HIV, 2.7% were people living with hepatitis B, and 35.3% were people living with hepatitis C. While reaching out to the care recipient through the digital CLM process, we collected valuable feedback on 5 key areas, that is acceptability, accessibility, affordability, and quality of services. This helps us to understand the real experience of the care recipient in terms of the service they receive. Beyond monitoring, beyond just monitoring, this initiative also serves as a medium to enhance the awareness and education around disease prevention, diagnosis, treatment, adherence, and care options. This gives community the knowledge they need and encourage them to seek for better care. Apart from collecting feedback and raising awareness, the CLM data collection also gives us the opportunity to prompt the care participant to better understand on various issues through the indicator we track. So through their response, community members have also shared type of stigma and discrimination they face, whether at the local health setting or the educational setting or the workplace setting or within the household setting. In summary, this CLM initiative also helped us to identify stigma and discrimination experienced by people living with HIV across different settings. So it is not only about collecting feedback based on 4AQ framework. Yes, of course, the CLM the CLM initiative was first created to check the quality of service using the 4AQ framework. But as we talked with the care recipient and community member, we found many important issues happening outside the clinic, especially those affecting women and children. So our work goes just beyond monitoring health. The valuable insight gained through direct engagement lead to a meaningful action. I will briefly explain each action for better clarity. The first action is about educational support. During the data collection process, we found that some parents were struggling to support their children education. Seeing this problem motivate us to find a way to connect them with government support. As a result, educational support was provided to 20 children living with or affected by HIV through the government welfare scheme. The second action is about human rights violations. So during the process, we identified 8 cases of human rights violation against people living with HIV, which include a widow being denied their inheritance right, children being refused for school hostel admissions, discriminations by the family members, and unwanted disclosure of HIV status. So with the support of the existing law, all the 8 cases were registered with the Ombudsman and successfully resolved. Still, some more cases are still in the process. And the third action is about inclusive health access. We met a paralyzed patient who did not get HIV treatment because he cannot move his bed, and his wife was not aware about the services available under the national program. Thanks to our peer support team, the person is now able to start Hep C treatment through flexible service delivery. And the third action is about improving legal awareness. See our dashboard. So 92% of the people living with HIV accessing ART from the government hospital not aware of HIV/AIDS Prevention and Control Act, which is an legislation enacted by the government of India in 2017 to address HIV-related stigma and discrimination. This initiative helped raise awareness about anti-discrimination law and gave PLHIB the confidence to fight stigma and take action to protect their right. We also found issues with the availability of medicine and supply during data collection. Based on this, we took steps to prevent stock shortage and stock out of the commodity to ensure continued access to required treatment. Our CLM process also helped us facilitate re-initiation of HIV treatment. With trust built during data collection, some respondents confidentially share about people living with HIV who had dropped out of treatment. As peer within the community, we supported 3 of them in reinitiating their HIV treatment. A total of 3,167 people at risk received hepatitis B vaccination. Hepatitis B vaccination coverage is, again, through different engagement we undertake. The service we provide at drug treatment center and for family or people living with HIV help us to increase hepatitis B vaccination coverage. We supported 378 people in assessing hepatitis C RNA testing for diagnosis and helped 46 people complete their SBR testing to confirm cure post-HCV treatment. So this action shows how community-led effort can address broader social and structural barrier to healthcare. In conclusion, CLM, our community-led monitoring approach has proven to be more than just a way to assess healthcare services. First, the CLM create a vital platform where care recipients can actively share their experience and feedback. This makes sure their voices are heard and help decide how services can be given. Second, their feedback help improve the quality of healthcare, raise awareness about the disease, and lead them to a better diagnosis and treatment. Third, beyond health, our CLM also support access to justice by helping protect the legal right of individual. So in this way, CLM not only improve health outcome, but also empower the community and promote fairness in the system. So for more information, you can visit our website at the link below. So lastly, I would like to express my sincere gratitude to Treat Asia for their technical guidance throughout the process and to provide us the financial support for the last 4 years. We also like to acknowledge our community implementing partner Peduli Hati in Indonesia, and also Coalition Plus for their financial assistance since this year, January, through the SASI platform. Thank you very much.
Yeah.